Mr. Chairman, the Chief of Staff of the Presidency, Honorable Minister of Health, Honorable Ministers and Deputy Ministers, Board Management and staff of Kolebu Teaching Hospital, partners and sponsors of the Rebecca Foundation, invited guests, distinguished ladies and gentlemen, members of the media. There's something about a sick child that tears at one's heart. And there's nothing as disheartening as knowing what to do for a sick child, but feeling inadequate to do so. This was the frustration that our medical staff faced on a daily basis at the Kolebu Child Health Department. This was the frustration that parents of sick children also faced. Sometime in 2017, Kolebu Child Health requested the support of the Rebecca Foundation to help fix the challenging conditions facing the department. Our subsequent inspection revealed a situation of limited space and inadequate equipment, resulting in delays and avoidable deaths. My first thought was, this is not the Ghana our forebears envisioned. This is not the Ghana our children expect from us. No matter how brilliant, committed, and dedicated our health employees are, they simply cannot give of their best without the needed inputs. My staff and I decided to do something because at the Rebecca Foundation, we believe that the ability of any society to take care of the vulnerable, especially children, shows the humanity of that society. After extensive discussions with the management of Kolebu, we learned that in all its 96 years, Kolebu has never had a pediatric intensive care unit, which was surprising. We knew then that we had to give them one, but we decided to go further and build a facility that also has a neonatal intensive care unit and a high dependency unit. Work earnestly began, and today it is my joy and the joy of the hospital to commission this modern, fully equipped facility for our children. Distinguished ladies and gentlemen, today is certainly a happy occasion, but today should also be a day of reflection and a call to action. How did we, as a country, get to where we are today, where our premier teaching hospital would have such challenges in taking care of our children? The experts may have their positions on this question, but permit me, a non-expert, to also state my humble view. I believe it is important to pay attention to planning and its execution. Planning that takes into account all the variables that affect the quality of the care in an institution like Kolebu. Strategic planning that allows us to learn more about the organization, share our perceptions, and discuss critical issues affecting or likely to affect the organization in the future. Planning that allows us to determine the resources needed to provide the quality of care desired. But planning alone is not enough. Execution, including monitoring and evaluation, are absolutely vital. Another area where we fall short sometimes is in resource allocation and mobilization. The state and its relevant institutions have a great role to play in this. But as we know, it is a huge task for the state to provide all the resources needed by all sectors. This is where organizations like the Rebecca Foundation and others come in. I call upon institutions, NGOs, and charities to support our health sector. I also suggest that the departments in Kolebu and similar institutions should consider establishing endowment funds. I entreat all of us to support any department which chooses to do so. Distinguished ladies and gentlemen, biomedical engineering is pushing the frontiers of medicine in a way that is incredible. Some inventions that would have been perceived decades ago as simply science fiction have become a reality. The world is moving fast in innovative breakthrough medical interventions. We cannot afford to be left behind. How can we advance, though, when we all acknowledge that we have a poor maintenance culture? I have in the past 29 months visited many health facilities The story of broken down equipment, lack of spare or replacement parts, broken down infrastructure is all too pervasive. We have to change this narrative. There must be strict application of maintenance protocols. We have to take good care of our existing infrastructure. We also need to pay attention to continuous training of health staff to match global trends in health service delivery. Training presents an opportunity to expand the knowledge base of all employees. In this day and age, there are many ways of learning, including e-learning, available. Let's take advantage of them. Distinguished ladies and gentlemen, it is important to state that the Rebecca Foundation, which was established in 2017, has been blessed with partners, benevolent institutions and individuals who have supported our work. Thanks to these donors and partners and my hard-working staff, we have achieved some successes in education, health, and women's economic empowerment. But it is in the area of health that we have made the most success. So to our donors and partners, here are some of the things we have done with your donations in the area of health. Under our community health outreach initiative, we have screened and treated about 2,000 Ghanaians, referring some to health centers for more advanced care. I take this opportunity to thank our young, hard-working, and dynamic team of health personnel. God bless you for taking care of the vulnerable. We have also equipped a new Chiefs compound at Sedwasi in the Greater Accra region and renovated and equipped the Abam Chrome Health Center in the Eastern region. We have, with your generous support, made donations of hospital equipment and consumables to all the 10 regions of Ghana before the creation of the 6 new ones. Additionally, we have donated phototherapy machines to the Princess Marie Louise Children's Hospital and the Cape Coast Teaching Hospital. Last year, we partnered with Brain Project, Global Outreach Consortium, Future of Africa Foundation, and the GCB Bank under the Restoring Hope Project to screen over 3,000 persons in the Ashanti, Greater Accra, and Northern regions. We performed over 200 surgeries, including 25 complex surgeries. I thank our team of doctors and other health professionals from the USA, Germany, and Ghana, and other partners for the success of this operation. I am happy to report that we subsequently donated equipment and medical supplies to the Ridge and La General Hospitals. We plan to organize another one this year. Our biggest project was a fully equipped maternity, neonatal, intensive care, and pediatric intensive care units at the Konfo Enochi Teaching Hospital. Again, we could not have done this without the support of our donors and partners. And today, we are commissioning a pediatric intensive care unit at the Kolebu Teaching Hospital. Someone asked me if I was not daunted by these projects. My response, I am not daunted by the possibility of failing Ghanaians, especially our children. After all, at the Rebecca Foundation, our motto is an opportunity to make a difference. On that note, I wish to thank our generous donors again, the board management and staff of Kolebu, for their cooperation and expert advice. The contractors, African Building Partners, who again have done an excellent job. The media, who always give voice to our work. The hard-working staff of the Rebecca Foundation, and indeed all Ghanaians. May God bless our homeland, Ghana, and make us great and strong. Thank you.
The First Lady of the Republic, Her Excellency, Mrs. Rebecca Akufo-Addo, please appreciate the Mother of the Nation.